clinical advice that I get tells me from my Chief Medical Officer to my National Clinical Director that we should expect a COVID wave. This winter, you're right, when you look at the ONS stats over the last couple of weeks, the trend has been relatively uncertain. But if we look at some of the other statistics that we've got, it helps to give us that broader picture. It certainly seems like there's some variants where we're starting to see a bit of an uptick in some of our cases. So we keep a really close eye on all of the data from wastewater right the way through to ONS and everything in between. But we are expecting another COVID wave. That's why it's so important that if you're eligible for the vaccination, that you come forward and get yourself vaccinated, because we know that can help reduce your chances of being hospitalised and being severely ill. So we've still got that pent-up demand over 2.5 years of the pandemic. That's not gone away because of the issues also in social care and social care recruitment. We've got significantly high levels of delayed discharge in hospitals, which obviously affect the flow. Add to that a potential COVID wave, add to that a potential resurgence of flu, and add to that the usual winter trips, slips and falls. All of that cumulative pressure means that this could be, if not the most challenging winter, probably one of the most challenging winters we've ever faced. So I announced in Parliament £600 million of funding to help with our winter resilience overview, and that's invested significantly in different parts of the health and social care services. A big key part of that plan was to recruit additional staff, and on staff of course being part of that, but also registered nurses, midwives, AHPs, advanced practitioners to help, as I say, right across the system to help with some of those significant pressures. But even with all that investment, which is important, and we'll do that, I still think it's going to be a really challenging winter. We'll be meeting with trade unions and employers later this afternoon. Look, they were pretty clear and unequivocal that their members rejected robustly the historic 5% deal that we offered last time round. So it's incumbent the government then has spent that time and come forward today with a significantly improved offer. Now, I'll not give you the detail of that because it's right that I do that in the room with the trade unions, but we will be offering that significantly improved offer. But I'll continue to negotiate, I'll discuss, and keep discussing, and we'll stay up all hours of the night where necessary to get to an agreement. Because the last thing I want to see, and I believe it's the last thing the trade unions want to see, is industrial action at a time where our health service really can't afford it.
What impact would industrial action have on the health service and on the country as a whole?
It'd be catastrophic. There's no getting away from it, there's no sugarcoating it, there's no looking at it with any rose-tinted spectacles. It would be utterly catastrophic given the pressures I've already outlined that we're going to be facing this winter, and then having industrial action on top of that would just be devastating for the health service and for the outcomes of patients and the public as well. So we'll do everything we can in our gift to try to avoid that. I think the trade unions are negotiating in really good faith as well. I think they also want to avoid that. So we'll get around the table this afternoon and hopefully see where that takes us.